This is The Rounds Table.
Welcome back, Rounds Table listeners. This is John Fralick, one of your hosts. Today, we're doing a solo episode. The paper is Fecal Microbiota Transplantation versus Vancomycin for Primary C. difficile infection, a randomized controlled trial. This was published Annals of Internal Medicine, June 2025, by Jewell et al. So what was the question here? Well, they wanted to know, does fecal microbiota transplantation improve outcomes as part of treatment for primary C. difficile infection? We've all seen patients admitted with C. diff, and unfortunately, rates of recurrence are quite high, with anywhere from 10 to 20% of patients experiencing recurrence after initial treatment. Currently, oral vancomycin is recommended as the first-line treatment for those with new C. difficile. Fecal transplant has been shown to play an important role in the treatment of recurrent C. diff. However, there's limited evidence around the role for fecal transplant as part of treatment for primary C. difficile infection. So how was this study done? Well, this was an investigator-initiated, open-label, assessor-blinded, multi-center phase 3 randomized clinical trial at 20 hospitals in Norway. For the patient population, it was adults age 18 and older with primary C. difficile, defined as diarrhea with a positive stool test for C. diff and no diagnosis of C. diff in the prior 1 year. Patients were excluded for a few different reasons, including if they had diarrhea from some other cause, if they had an indication for ongoing antibiotics for a different infection, if they had underlying IBD, a life expectancy of less than 3 months, serious immunodeficiency, or if they were pregnant. For the intervention, patients were randomized 1-to-1 to either a fecal microbiota transplantation enema administered within 24 hours of randomization. For the comparison, it was standard of care, and this was treatment with 125 milligrams of oral vancomycin 4 times a day for 10 days. The primary outcome of interest was clinical cure at day 14 after the start of treatment and no recurrent C. difficile infection 60 days after starting treatment. Cure was defined as fewer than 3 stools per day or firm stools for at least 48 hours at day 14. And recurrence was defined as diarrhea for more than 48 hours between days 15 to 60 after the onset of treatment, a positive stool C. diff test, and a clinical indication to start retreatment as judged by the treating physician. So who's included in the paper? From June 1st, 2019 to March 15th, 2024, about 1,200 patients were screened, and ultimately 104 were randomly assigned. Of these, 3 in the fecal transplant group and 1 in the Vanco group did not receive their initial treatment and so were excluded from the analysis. The median age was 70, 32% were female in the fecal transplant group and 26% were female in the Vanco group. About 19% in both groups were on a PPI, about 40-ish% had received antibiotics in the prior 3 months, and about 17% of patients had met criteria for a severe C. diff infection. So what did they find? Well, the trial was stopped early based on an interim analysis. The proportion of patients with a clinical cure at day 14 was 70.6% in the fecal transplant group and 77.6% in the Vanco group. Of these, 2 patients, or 5.6%, had a recurrence from day 15 to 60 in the fecal transplant group. This was compared to 8, or 21%, in the Vanco group. And so, 34 of 51 patients, or 66% of patients in the fecal transplant group achieved clinical cure and had no recurrence within 60 days. This was compared to 30 of 49 patients in the Vanco group, which was 61%. This result met criteria for non-inferiority of fecal transplant compared to vancomycin, but did not meet criteria for superiority. There were no significant differences in adverse events between the 2 groups. There was 1 death in each group due to recurrent C. diff. So how about a few study limitations? Well, this was an unblinded study, and so investigators may have treated early signs of treatment failure differently in the fecal transplant group compared to the Vanco group. This was also a smaller study, and this likely limited the ability to confirm if there was also a signal for superiority of fecal transplant over vancomycin. So what's the takeaway? Well, this phase 3 randomized trial shows that fecal transplant was non-inferior to vancomycin for the management of primary C. difficile infection. So is this practice changing? I mean, practically speaking, I don't think we have the infrastructure yet to pivot to fecal transplant as first-line treatment. But if these results can be replicated, it would suggest a game changer in the management of primary C. diff. With that said, I'd always defer to my ID colleagues though. And so if any of our ID colleagues out there want to weigh in, please send us a message. Well, that just about wraps up this rapid fire episode. For the good stuff, MedicinePods.com is currently hosting I Am Pharmacy as a new featured podcast. I was just listening to a great episode called From Lab to Market, providing insights into knowledge translation and commercialization. Really interesting, and it's got great background music. I'm a big fan. All right, everybody, thanks a lot for listening. Talk to you next time. The Rounds Table is hosted online at MedicinePods.com, your one-stop source for comprehensive internal medicine education and evidence-based medicine resources. We can also be found on all of your favorite streaming services. You can also follow us on Instagram, LinkedIn, and X.